So this PowerPoint basically talk about the VISTA of nursing, or we can tell here, this PowerPoint we are going to talk about the nursing profession, how we practice or nurse, because nursing is a profession where the healthcare sector focus on the care of individual, families, and communities so they may attend, maintain, and also recover the optimum health. And also we try to maintain the quality of life. All we discuss in this PowerPoint. This PowerPoint based on the book we call Fundamental of Nursing Care, Concept, Connections, Skill, right? And also the scope of practice. First page here, the milestone of nursing history. In this page, basically some important year mentioning the ancient time, the care provided by the family, and also the male priest. In 1000 AD, women allowed to study the midwifery, means the women's dealing with the pregnant mother, delivery, and post-delivery care, and also the neonate care. 17th and 18th century, it was very poor, or condition was the poor, and low-class women provided the care. 1836, the first school of nursing established, and the first school was in Germany. Later on, the 1897, the Nurses Associated Alumni of the United States formed to protect against incompetent nurses. 1892, the first training program established for practical nurses in New York City. Early 19, license requirements started in some state. And 1955, all states required practical nurses to be licensed, right? Means NCLEX exam started. In this picture, we can see one of the pioneer of nursing science. Her name is Florence Nightingale. Okay, and she started her work during the World War. Here's few names who is very iconic in our nursing science. One is first one name is Clara, then Dorothy, Florence Nightingale, then Mary, Linda Richard, Hampton Robb, and also Lillian or Annie Goodrich. So few names here, but we want to focus only two persons. One is Florence Nightingale. So she started modern nursing science, and Nightingale is received in founder of modern nursing. She started, okay, and her substantial contribution to health and nursing are well known, very well known in the world. And she also correlated the nursing with a Victorian ideology for female, right? As a female, I said. So, and because that times when she started, it was not easy to work for a female. And even somebody say that Nightingale is very responsible for gender issue in nursing, and throughout the history in the military or more men enrollment in nursing program is changed the nursing image basically. Another person is very important. Her name is Dorothy Dix. Dorothy Dix actually started her life as a volunteer, okay, or volunteers selected as the superintendent of women nurse due to the need of nurses. Yeah, okay. And Dorothy, she worked hard to get women to work in military, and I mean military hospital in order to help the wounded military. And some guideline to get accepted into the hospital to be nurse, and at least 30 years ago, because Dorothy can start all of this. And also uh, she worked for the women. They can participate in the health sector. This is the two person very iconic in our nursing science. And also, I told you another person is important. Her name is Linda Richard. Linda Richard also first professional trained American nurse. Okay, and she established the nursing training program in United States and also in Japan. Okay, let me go next. Here the type of nursing program. So here the few nursing program like licensed practical nurse, also called vocational nurses, associate degree of nursing, then diploma program and bachelor degree programs, right? Also for registered nurse, we called RN, for LPN and LPN, also PN to ASN program, PN to BSN, PN to ADS, ADN, or ADN to BSN, diploma to BSN program, and also Master of Science program, shortly called MSN, and Doctorate of Nursing, it is PhD or DNP. So in this, program structure, basically nurse account for majority of the healthcare workforce, and they play a very critical role in ensuring the delivery of quality care. Because of this, we need a very trained or licensed program, accredited program. Hmm? I said that it is very important. We have to deliver a quality care from a nursing assistant in the assistant to the superior position of the nurse, particularly when we work in ER, all the way up to a senior nurse administrator to the hospital executive team. So in hospital, we have we give the care to the patient, and also nurse has a big role to administrative works. Even not sure when in hospital when we work, we must need the certificate, we must need the license. Whatever it is, we also follow the guidelines. Okay. And also there are different level of nursing degree, and we learn more about what we can do with that degree. So first of all, it is licensed practicals. The program is 9 months to 1 year. Most basic entry student get in licensed practical program. In California, we call this vocational nursing, shortly LPN. So when you have this, you can go for associate degree. It is 2 years program, entry education level for registered nurses. Then diploma program, 3 years hospital-based program, bachelor's degree, BSN, 4 years program. Focus more on management and leadership. So whatever you have associate degree, diploma degree, BSN degree, you have to sit for NCLEX board exam to get the license. When you have, if you are LPN, when you have LPN, you are allowed to for registered nurse program. There are student organization in NSNA and professional organization as well. It is called ANA. For LPN or LVN, means vocational nurses, student organization is called HOSA. Job, they actually help you to job looking for skill, outstanding chapter. They help to get CPR, first aid, and also practical nursing skill. If you want for more information, you can go their website www.hosa.org. Another professional organism is called NFLPN. If you like, you can go and search from Google. So career leader in nursing. So who want to be a leader, right? Sometimes leadership born by born, sometimes leadership developed when you start to work. So 1+1 program prepared the student to take the NCLEX PN after 1 year and NCLEX RN after 2nd year. PN2 ADN, Associate Degree of Nursing program, give the credit for LPN education towards the RN education. Direct, you can start PN to BSN, okay, or associate degree to BSN, and also you like diploma to BSN program. Provide entry-level nursing credited towards BSN. Some post-graduation education. So if you want to go for postgraduate education, you have to have the RN license. So you can apply for Masters of Science in Nursing, shortly called MSN. It is 2 or more years in graduation program. When you go any site, always look for accredited institute. Otherwise, it would be hard for you to get license. Or may teach in BSN, ADN, means Associate Degree of Nursing, LPN program, doctorate in nursing. So when you have MSN program, then you are eligible to apply for PhD or DNP. PhD mostly focus in research or teaching profession. DNP more focus in clinical side or executive track. So 2 or more years you need for doctoral program, or may teach the MSN and doctoral program both. If you like, you can go and teach. Advanced practical nurses. So clinical nurse specialist. If after they get your RN license or DNP program, you can be focused in a particular area. So you apply for clinical nurse specialist. If you like in clinical career, you can get nurse practitioner license. It is a different exam. Also certified registered nurse anesthesia. So if you want to go anesthesiology, you can go, but you need 1 year training in ICU or acute care or any surgical unit. Also, nurse midwifery, who want to make their career in, mother who go to pregnant or pregnant mother, delivery, newborn care, all of the nurse midwifery program. So here is a few more information about our Nurse Practice Act in all state. Okay, and also we are going to focus some common issues. So this included required that LPN or LVN be supervised by RN. So when we start work as a LPN, we have to work under direct supervision of registered nurses or direct supervision of physician, and that RN be supervised by the physician as well. Establish the scope of practice for each level of nurse based on educational preparations. Also, Board of Nursing in each state determined and enforced the content of state of NPA, right? So NPA stands for Nurse Practice Act in all state. Now, scope of practice. What does it mean, scope of practice? So the term, the scope of practice basically refer to the range of some roles, functions, responsibilities, and also activities which a registered nurse or midwifery is educated, competent, and have the authority to perform. The scope of practice of nurses influenced by few factors like the setting in which nurse practice work, the requirements of employment, and also the need of the patients. So uh, when we go for work and the scope of practice, there's some limitations, allowance of what a nurse can do, nurse responsibilities for knowing their own scope of practice, and board of nurses in which the state determined and enforce the content of Nurse Practice Act. For example, in some state, LPN are prohibited by the Nurse Practice Act from initiating the intravenous therapy, except in California. In other states, LPN or VN are allowed under the law to perform the skill. They need a certificate in particular field. So whatever the scope of practice, I told you, we have some roles, function, responsibilities, and also we need some training or education, competent, and authority allow us to work, right? Next, go. So Nurse Practice Act, what is that, right? So Nurse Practice Act means there are some law or governing nurses action written to address each specific level of nursing. Also established the scope of practice for each level of nurse based on educational preparations. Okay, based on educational preparation. So the Nurse Practice Act basically no employer or healthcare agency can give you the permission to do something that your license or state license practice act does not allow you to do. You understand? Let me recap it. I said Nurse Practice Act basically deal or some law we have to follow. So I said no employer or healthcare agency can give you permission to do something that your license or state Nurse Practice Act does not allow you to do. Also, when we work, we have to follow some ethics, or ethics in nursing deals with the rules of conduct, which is the right and what you should to do in a particular situation. So they actually deal with this. And as I told you, the ethics is very important, or ethical values are the base of nursing law. Okay. And also, when we educate, get our training or knowledge of your state nurse practice act will help you in making the nursing decision, protect you against the act and decision that could involve you in the lawsuit or criminal uh, prosecutions. What next? Next here, 4 characteristics of competent nurses. There are 4 characteristics. Okay. So here, 4 characteristics I said. So being responsible, be honest, being caring to your patient, also being competent. So if I ask you what are the characteristics of successful nurses, definitely the nurse showing a natural tendency to truly care about how the patient feel, and in turn how well they perform their job or will have a significant impact on their success. And I mean, let me explain in different way. So why it is important to define the nursing competency? Hmm? There, I mean, the reason being, or it is very important to clearly define the nursing competency to establish a foundation for nursing education curriculum. However, while the concept of surrounding situation or nursing condition, we always nursing competency include the core abilities that are required for fulfill one's role as a nurse. Therefore, it is very important to clarify, define nursing competency to establish a foundation for nursing education curriculum. However, while the concepts surrounding nursing competency are important for improving nursing qualities, and they are still not yet completely developed, and I want to tell you, still it is very challenging. This is the reason when you work, you have to have be responsible, you have to be honest, truthful, never harmful. You should be caring your patient and being competent. So I said it is very challenging, and challenge remain in established the definitions and structure of nursing competency or competency level necessary for nursing professionalism, training method, and so on, right? And let me go next here. The responsibilities. Caring for several patients and seeing that their physical and spiritual needs are met. So why patient come to hospital? Nobody want to stay in hospital, right? So they want to be happy or get rid from their pain. But same time, we need to ask what is their special need or any kind of spiritual need, because spiritual need sometimes influence your health, performing patients and family teaching, and preparing them for patient discharge. So when we admission or admission in a patient are target to discharge, right? Otherwise, we need to make room for new patients. How we do this? Also, noticing changing the patient conditions and notify appropriate healthcare professional. So, like my patient hospitalized because of high blood pressure or diabetes, but I'm careless, my patient get pneumonia, we call hospital acquired pneumonia. That times we need to cohorting the patient. We need to transfer the patient in radiology for the X-ray of the chest, or we need to transfer the patient in pulmonology unit, right? So we have to communicate with the other unit what should be next decision for my patient. So next go, nursing in both art and science. Basically, here we are going to define or we are going to figure out the definition of nursing as an act and nursing as a science. Let me talk first one, nurse of a, act of nursing. The nurse caring creativities, communications, and compassion necessary to connect with the patients in the meaningful way. So it is the act of nursing. So the act of nursing is the art of caring the sick person and well individual. It basically refers to the dynamic skill and method in assisting the sick person and well individual in their recovery and also in the promoting and maintaining the health. The nursing is an act. It involves the creative applications of knowledge in and servicing the peoples. The science of nursing, what is that? It analyzes and integration of data, the decision-making processes, and also technical monitoring of patients. So nursing as a science, it is the body of abstract knowledge. And this arrived through the scientific research or logical analysis. And science of nurse is the scientific knowledge and skill in assisting individual to achieve the optimal health. And it is the diagnosis and treatment of the human response to actual or potential problem, right? And next to go here, the attribute of a good nurse. So how we be a good nurse, right? What are the criteria I need? So what makes someone a good nurse, basically? Okay. So a good nurse must be communicate well, take responsibility for own action, and also look for self as a professional and act and dresses accordingly. So, as the national largest healthcare profession, the LPN or registered nurse are showing no sign or slowing down because it is very important. A good nurse must be caring the patient, okay, while it may seems like a given, most people assume that the all nurses enter the field because caring is one of their leading qualities. But this should not necessarily be an assume nursing characteristics. Okay, so caring is the most important. Second thing is communication skill. So very strong communication skill are critical characteristics of nurse. A nursing role depends on relay on ability of effective communication with other nurses, with physician, or discipline across other unit, patients, and the families. And also, I said, you take responsibilities for own action. You have to be empathy and attention to deal. And also, a good nurse knows the, uh, I mean, have to have the able or at the high of their and make the most other individuals. They are capable to problem solving skill, and they have enough stamina, and also look for self as a professional and act very well dressed up accordingly. And also they have to have the sense of humor, also commitment to the patient's advocacy, willingness to learn, right? And critical thinking, they should be able to critical thinking, also have to have the time management abilities, and most important, leadership. And definitely experience also important if you want to be a good nurse. Benefit to joining professional organism. So gives the nurses a um, collective voice heard by those who establish the healthcare policies, provide opportunities for leadership in nursing, and also professional appearance and behavior. You will be expected to appear and behave in a professional manner during your nursing educations and in your nursing career. Or sure, or bath and apply, deodorant daily. So, you have to interact with the other client. Keep the hair clean, styled appropriately. Wear the clean undergarments. Wear a clean skirt and uniform that fit well without tear or wrinkle. Wear the shoes that are clean, in good conditions with a clean soles. Cover any invisible tattoos. Remove any kind of, that is not way to show up to the facilities. Keep the fingernails short, clean. This help prevent scratching patient or injury to themselves. What else? Professional behavior. Active, on time, arrived on time, prepared to work. Complete assistance care during your shift. If you are unable to do so, ask for help. If you are caught up on your assignment, or offer to help someone who is behind. So sometimes you ready to get help, sometimes you ready to give the help. So give thoroughly care with no shortcut that compromise patient safety or comfort. Take the breaks on time and return on time so that others can go their assigned time. Also leave the unit only after you have ensured that another nurse is aware that you are going and will be responsible for your patients while you are going. Assume responsibilities for other nurses and patients when they leave the unit be kind, be supportive to other nurses and also healthcare professional. Avoid criticism, the mistake of others, since you will undoubtedly mark mistake too. Hmm. Look for positives in people's patients, family members, co-worker, and your supervisor. Example of unprofessional conduct: use of drugs or alcohol in ways that endanger a patient's, diversion of drugs from patient to professional use, failure to supervise your nursing assistant, and failure to provide adequate care for patients, and also criminal conduct. So all of those are not professional. Here we are going to talk about some nursing theories. So here the list of person who is very important for nursing theories. So nursing theory and practical nursing or our nursing science, the theory assists the practicing our nursing. The nursing theory helps to organize the patient data, understanding patient data, analysis patient data, make the decision about the nursing intervention, and also help to plan patient care, predict the outcome of care, and also evaluate patient outcome. So nursing theory can help. But here, talking about some nursing theorist means some person who give the nursing theories, right? So before to go all of those, I want to tell you. So nursing theory or nursing theorist, they aim to help you understand what com comprise a nursing theory and its importance, purpose, history, types, and classification, and gives you an overview thoroughly summarizing of selected nursing theories. The few name is very important, okay, that we have to know. So I said one of the important name is Nightingale Forosens, Virginia Henderson, Faye Abdullah, Jane Orland, Dorothy Johnson, and Rogers. So nursing theories, basically it is the are organize the body of knowledge to define the nursing is and what nurses do and why they do it. And nursing theory provide a way to define the nursing as a unique discipline that is separate from other discipline. Like other discipline means medicine, right? Nursing and medicine, two different department. And it is the framework of concept and purposes intended to guide the nursing practice at a more concrete and specific level. So definitely in this PowerPoint, we will talk about some philosophy, some theory, some concept, some model, and also conceptual framework. One by one, we will explain. As I told you, there are few names there, like I said uh, here, the Faye Abdullah, she published her work in uh, typology of nursing problem. She focused on the nursing problem. And which basically shift the force of nursing from disease-centered approach to a patient-centered approach. She explained about this. Other here, Jane Orlando emphasized the reciprocal relationship between patient and nurse and view nursing professional function as finding out and meeting the patient's immediate need for help. Another person here, Dorothy Johnson, is a pioneer of behavioral system model and also upheld the fostering of efficient and effective behavior functioning in the patients to prevent the illness. Another person is Rogers. Rogers views the nursing as both as a science and a art, as it provided a way to view the unity human beings who can integrate with the universe. Another person is called Dorothy Oram. She started in her theory that nursing care is required if the client is unable to fulfill biological, psychological, and developmental and social needs. Out of all, I want to remind one person, Florence Nightingale. Basically, she defined the nursing in her environmental theory and also the act of utilizing patient's environment to assist him in his recoveries. And also few names more here. One is, like I said, King, Imogen's King. The theory of goal is, that person established the theory of goal at and started that the nurse is considered part of patient's environment, and the nurse patient relationship is for meeting goal towards the goal of health. The other person is like Betty Newman. Betty Newman developed the philo in her theory, state that the many needs exist and each may disrupt the client balance or stability. Threats reducing is the goal of the system model of nursing practice. She established it, Betty Newman. Another person is Jane Watson. Jane Watson developed the philosophy of caring, highlighting the humanistic aspect of nursing as they intervene with the scientific knowledge and nursing practice. Okay. And also, another person, Senior C. Roy, view the individual, that Roy view the individual as a set of interrelated systems that maintain the balance between these various stimuli. Important, right? And next few names here more. Impact of nursing on patient's life. So nurses are 24/7 caregivers. Nurse note the change and draw the conclusions. Conclusion to alert the physicians to so patient contribute to not get worse. The nurses establish a positive relationship with patients, allowing for teaching opportunities. Next, information in connecting features. So very important here. So when we work as a LPN or as a RN, we get some knowledge from our school. We learn anatomy, what are the structure of the body, how bodily work, how our cell work, means physiology. And when a disease process starts, it is pathology. So my anatomy knowledge coordinate with my physiological knowledge. When abnormalities occur, means bodily disturbed, physiological not work, and disease started, pathology. So we have to have coordinate our knowledge with our clinical experience. So clinical connection is important. And knowledge we learn from school: anatomy, physiology, pathology, pharmacology. And then when we start to work, we get experience. Peoples and places, right? We get exposed with the diseases. Individuals' requirements is different. Also, when we take the history from the patient, get the sign symptom, we call data collection, and we examine the patient. After that, coordinate and collaborate with our experience, and we go for diagnosis, and it is called nursing diagnosis, because nursing diagnosis not on based of laboratory data at the beginning, but when laboratory data come, that we coordinate what are the abnormalities, we inform physician, we inform patient. Lab and diagnostic test help to get confirmation diagnosis. Also supervision. So when I am very new, I work under supervision of someone. But when I got experience after a few days, I do supervise others. And also as a RN, I can delegate other health worker like LPN, like CNA, and who is fit for what. Like a very experienced RN supposed to go for unstable patient, but who is new RN supposed to go for the patient who is very stable. How you know it is stable or unstable? We just simply check the vital sign. Also coordinate with the real world, post-confined. So after giving the services to the patient, we always go for post-conference, right? And then patient teaching. So like a patient is ready to say goodbye, that is we educate them. This is the medication, when you should take, what with food or after food or before food. Like statin is a medication we give low to low the bad cholesterol. Cholesterol synthesis in the body at the evening time. So we tell your patient take that statin at the bedtime or night time. So it is good to stop this cholesterol synthesis. At least it is important to educate your patient. Same medication take every day in the same time. If you take morning, morning. If you take evening, every day should take evening, right? So if educate the patient is important, and not only educate. After this, you have to go for demonstrate remodeling. What you say, tell them to rephrase it, and also every knowledge and skill related to our anatomical knowledge, our physiological knowledge that we learn from our school. Information in safety features. So why are particular safety features so important that they are highlighted as a safety issue? And what could happen if those safety guidelines are not followed? So I said, when you work in the hospital, you will see so many error. So what are the most common error in the hospital? Like medication error or wrong drugs, right? So in acute care, if you work in the acute care, after review, you have to find this is the error or medication error. You have to range from overdose due to wrong dose calculation or commission of medication or wrong medication choose for the patient, right? It is good to follow the guideline because medication error result in more than 30,000 deaths annually and also high number of harm associated with the medication error. So it is important to follow the safety guideline, right? What else? Evidence-based practice, another keyword in our uh, nursing science or medicine science. So, what is evidence-based practice? Hmm? Problem-solving approach that use the best evidence from nursing research studies, patients' care data, and patients' preference and values. So, evidence based nursing practice, the real definition, practice of nursing in which the nurse makes the clinical decision on basis of the best available current research evidence and their own clinical expertise and need and prefer the patient, right? So, evidence based practice in nursing is a process of location, approaching, applying the best evidence from nursing and medical literature to improve the quality of clinical practice, right? So, now little bit talk about the quality and safety education on nursing. Again, I want to tell you, we improve the quality and safety on base of our evidence-based approach, right? Because evidence-based approach is a uh, making quality decision to providing nursing care based upon personal clinical expertise. Important. Hmm? Also, evidence-based practice, help to increase or improve the safety of education to the patient. So, little bit more about projects that focus on knowledge, skill, attitude needed by nurses to continuously improve the quality and safety of patients' care and quality and safety education for nurses include the 6 areas of focus for pre-license, right? So it is also a process that brings together the best available research, professional expertise, input from the patients and family. What are the 6 areas focus? Hmm? Pre-license area knowledge, what we learn from school, skill when we get experience, and our attitude, learning attitude, helping attitude, collaboration, development, effective communication, education, also quality and safety education for the nurses. Our focus always patient-centered care, means whatever we do, everything related to my patient. We work in a hospital as a teamwork and we help each other, right? We communicate with each other. It is collaborative work. As I told you, we also work evidence-based practice, right? Evidence-based practice is important. Okay. And other things is evidence-based practice, actually another collaboration on based of clinical expertise, based research, patient values, and evidence-based practice help to improve the qualities. Quality improvement always maintain the safety for the patient and informatics, right? Work together. So this is the 6th area we can focus in um, our nursing, and this all area discussed in the quality and safety educations for nurses. This is the PowerPoint for now.